We'll begin first with how Lyme disease is spread. From May through July, people will get more tick bites and tick-borne diseases than any other time of the year. And according to the Centers for Disease Control, where does disease start? Should you cancel all of your outdoor plans? WDVM's Aaliyah Williamson answers all of these questions and more.
It starts with a small tick.
It's just the size of a dot of a pencil.
Or actually an even smaller bacteria within the tick.
The disease is actually caused by a bacteria called Borrelia burgdorferi.
This microscopic bacteria carried by deer ticks, not even as big as this pen, can wreak havoc in a body.
Or release the bacteria under your skin. And from there, the bacteria can disseminate or spread into your blood. And from the blood, it preferentially attacks your joints or your nerves.
But how does it spread?
It's caused by a deer tick, and humans act as a dead-end host for the disease. So once I get Lyme disease, I cannot give it to anybody else.
That question and more should be asked as ticks become more active in the spring and summer months in the northeastern U.S. A recent report released by the CDC shows that illnesses spread by ticks have nearly tripled from 2014 to 2016. One answer for this trend?
Global warming in general is leading to more warm days than cold days. So we are seeing more ticks and people are more outside.
Experts say the best way to avoid tick bites is spray, something you can find at any local hunting shop.
As far as I know, DEET is the part of the chemical that helps deter the tick.
While it's a disease often associated with hunters and outdoorsmen, experts say ticks don't discriminate.
Technically, it doesn't always just necessarily have to do with hunters as well as anybody. Just roaming through the grass or going in the outdoors, it involves more than just hunters.
All age groups are susceptible to get Lyme disease. The risk factor is being outdoors.
While being aware is helpful, tracking down Lyme disease spreading ticks is tricky.
A person who gets Lyme disease may not even remember getting a tick bite because the tick is so small. It's very easy to not see a tick biting you, and you can still get Lyme disease.
So keep an eye out for the telltale bullseye rash or flu-like symptoms.
And most patients who actually get Lyme disease, they are quite ill. Really bad headache and muscle pains and joint pains. Basically, they become functionless.
Double check yourself whenever you return from an outdoor activity.
The ticks, my understanding, go to the warm extremities of your bodies, your armpits, creases. If you have long hair, try to run your hands through your hair. Have somebody else look through your head.
Or if you feel really worried, turn your tick over to the authorities.
What you can do is you can submit the tick to the Department of Health for Lyme disease checkup.
But most of all,
you don't have to panic. Like I told you, not all tick bites lead to Lyme disease. You watch for those symptoms for 2 to 3 weeks, and if you don't get those symptoms, then most likely you don't have Lyme disease.
Reporting for WDVM's In Focus, I'm Aaliyah Williamson.
The CDC says 95% of Lyme disease cases occur in just 14 states. Maryland, Virginia, and Pennsylvania are included in that list. And we move now to Maryland, a state that consistently ranks near the top for Lyme disease cases. But what steps are being taken to research the disease and educate the public? WDVM's Katie Mizraka speaks with experts and doctors to see what they have to say.
It's the most common tick-borne infection in the United States.
It's really hard to do research on it.
And it can be difficult to identify.
Diagnostic tests are the key, starting place for research, because if you can't measure or diagnose the illness, it's very hard to understand treatment, and it's also very hard to understand how to develop new treatments.
Dr. Ockott has studied Lyme disease for the last 10 years and focuses on diagnostic testing and health-related outcomes. There is only one main test to diagnose Lyme disease, which is based on an antibody response to see if a person's immune system recognizes the infection.
They're useful as a way to see if your immune system recognizes the infection, and that can be used to support the diagnosis. But there's a big flaw.
The flaw? The test does not actually measure the bacteria itself.
Patients can't benefit from a culture test, so we're looking for other ways to directly measure the bacteria.
The Johns Hopkins Lyme Disease Clinical Research Center is just one of many that are searching for a solution, but doctors are currently lacking the clinical tools to deal with the epidemic.
We need ways to measure and predict who's going to remain ill after their initial therapy.
As Lyme disease is one of the fastest growing infectious diseases that hits Maryland during the summer months, we decided to head to Baltimore to speak with a physician who is a part of the pediatric infectious disease to see where education can start.
Dr. Ibukun Akimboyo is a pediatric physician. She says half of the patients that come in talk about Lyme disease, and that is where the education efforts begin.
Physicians within infectious disease are doing a lot in terms of making sure the information that's out there is clinically correct. It is at a level that most people can understand it, and if people have questions, they know where to get resources from.
Resources include your local health department, your doctor, and state and federal websites. The Maryland Department of Health Lyme Disease website shares medical education modules and material to help people recognize and manage the disease. This includes a brochure called Maryland Get Ticked Off and a poster that details how to look for a bullseye rash to help detect tick bites.
The key way to catch it early is not to miss the round red skin lesion or rash that occurs at the site of the tick bite.
Reporting for WDVM's In Focus, I'm Katie Mizuraka.
Dr. Alcott says 85% of patients come in during the summer. Finding the right treatments for Lyme disease can be challenging since the disease affects many people differently. WDVM's Jonathan Hunter spoke to those who have the autoimmune disease as well as a doctor to get an inside look on what treatments work.
Rachel Long was diagnosed with Lyme disease 8 years ago. She says she was so sick that she almost died and at one point was in a wheelchair.
I lost all my lower extremity strength. My arms started to cave in and I just rocked back and forth. And I gained really severe food allergies.
Things are better for Rachel now. She has been symptom-free for 2 years. Rachel says that in addition to antibiotics, natural remedies have been a major help to her in her recovery.
Really what you want to focus on is like antimicrobial, antifungal, antiparasitic, so things that work in conjunction, but it's also mind, body, and spirit.
Rachel is not alone in the fight against Lyme disease. Renee Sharp is the president of the Chambersburg Lyme Alliance. Renee, her husband, and daughter were all diagnosed with Lyme disease. She says her daughter at first tried doxycycline and flagyl, but it really didn't work. She says once her daughter tried herbal treatments is when they saw a difference. So Renee and her husband tried herbal treatments as well.
For us, it was good because it builds your immune system as it kills the microbes that are invading your body. So we could build our immune systems at the same time as we were killing the invaders making us sick.
Dr. Timothy Stonecipher is a Lyme literate doctor in Shippensburg. He uses a combination of antibiotics and natural remedies when treating his patients.
And some people will come in and just want to do natural products. I think that's important. We have a pretty good interaction with my patient and says, well, what do you want? And so it's really a kind of informed consent patient care approach.
Stonecipher says that a lot of the treatments he gives his patients are contingent on how long a person has had the disease. He says usually treatments can go anywhere from 21 to 40 days, depending on the case.
Usually drug of choice is doxycycline for adults, children, amoxicillin. Oftentimes I'll add a second antibiotic in with some of the newer science that's showing persister cells that we may need to be using dual antibiotics or even triple antibiotics.
And many who have had Lyme disease agree that with the disease getting misdiagnosed often, it's important to have the right treatments.
I would not want to be treated for depression if I'm really not clinically depressed. So you have a whole host of other consequences whenever you're misdiagnosed and wrongly treated.
And if detected early, those who have it should be okay.
Or early diagnosis and early treatment with this disease is very curable. It's these later stage Lyme patients that they're very difficult to get better. It's a very complex disease.
Reporting for WDVM's In Focus, I'm Jonathan Hunter.
Everyone featured in this story, they live in the state of Pennsylvania, which leads the nation in Lyme disease. WDVM's In Focus. Now that we're in the summer season, the threat of ticks is at an all-time high, but health experts are offering some advice to residents for what they say is the most important step to staying disease-free. That's prevention. WDVM's Lena Schrazi has this report.
As the weather has warmed up, many people are ready to go outside and enjoy summer activities. However, with an increase in time spent outdoors comes an increase in the possibility of making an unwanted friend.
It's very easy for that little tick to get on you and you wouldn't even notice it. It could feed and drop off and you would never even know that it had been there because they're so small.
Health officials say the number of illnesses from tick bites has more than tripled in the U.S. between 2004 and 2016. Of tick-borne illnesses, Lyme disease is the most commonly reported in Virginia.
Lyme disease is a bacterial infection, okay, and it's transmitted by ticks. In our area, the tick that transmits it is known as the deer tick or the black-legged tick, and they're really active. The nymphs of that tick are really active at this time of year, so this is a good time to really be on the lookout for ticks.
There were 214 human cases reported in Fairfax County in 2016 and 178 cases in 2017. The most important key to bringing these numbers down: prevention.
County health officials offer some basic tips to help ticks from getting onto you this summer. Some of the basics: wear long sleeves when you go outside, make sure you wear socks with your sneakers, and in this case, safety over fashion.
When you're out in the woods or in nature, stick to the trails. Ticks like to climb up on the vegetation, and it's really when you brush up against vegetation that they're getting on your body and that they're looking for a place to feed. So if you walk down the center of the trail, you're less likely to pick up ticks in doing that. There are some repellents.
Brian Bullock, another health specialist who works with Lyme disease classification, stresses the importance of prevention methods. His daughter contracted the disease when she was 7 years old.
She said the back of her head was itching, so I looked back there and immediately saw what was suspected to be a deer tick embedded behind her ear. I removed that tick and unfortunately dropped it into the gravel, because normally I would keep that tick to have it identified later to figure out what diseases she might have been exposed to. Unfortunately, I didn't keep the tick. About 3 days later, my daughter developed a headache and fever, and also neck pain.
All classic signs of the onset of the disease. In short, situations like this could be prevented if the community is more informed on ways to prevent these bites and to keep these critters from ticking you off.
They have survived a long time by being sneaky and not by being noticed easily. This is what they do. So try to turn things in your favor by doing those tick checks regularly.
For WDVM's In Focus, I'm Alina Shirazi.
The Fairfax County Health Department put out an informational video to inform the public on the importance of tick prevention and key ways to protect yourself this season. We have a link on our website at localdvm.com. As a number of people diagnosed with Lyme disease continues to grow across West Virginia, legislators are stepping up to make a change. WDVM's Aaron Miller has more on recent laws passed that will open up healthcare options for those suffering from the condition.
When driving through West Virginia, it's hard not to miss the miles of wooded areas. But with beauty comes bacteria transmitted by ticks.
You have to kill the bacteria. Otherwise, it's going to try killing you slowly and painfully.
Now with the new law passed during the 2018 legislative session, insurance companies can no longer deny West Virginians coverage for Lyme disease treatment.
If the doctors indicate that it would be beneficial and necessary for the patient, then the insurance companies have to pay for it.
That includes detection tests, long-term antibiotic therapy, and more. With the help of local legislators, the bill was championed by Eric and Linda Pritchard, a Berkeley Springs couple with a personal connection to the disease.
Well, I have a dear friend that had Lyme disease. She was undiagnosed for 9 years. And she suffered terribly.
They saw how tedious and exhausting it is for someone fighting Lyme disease.
They're in such pain. Anyway, it just chokes me up.
After a bill is passed in the West Virginia legislature, it must be in effect 90 days later, which means part of SB 242 went into effect on June 6th. It's also stated in the law that if someone is diagnosed after January of 2019, the insurer must make all benefits available to them.
There is treatment out there, and so for an insurance company to say no, we're not going to cover this because it's a 6-month antibiotic treatment, that doesn't make sense.
People are most commonly infected by bites of ticks called nymphs. They're about 2 millimeters in size. So to put that in perspective, it would take about 9 of them all lined up in a row just to make the size of this dime.
You can have muscle problems, heart problems, It can go into your brain and give you problems there.
It leaves the ultimate decisions where they should be with the doctors, not with the insurance companies, but with between a patient and his doctor as to what's the appropriate therapy and course of treatment for someone who's under doctor's care.
Good news for those like Linda's friend who were changed by the aftermath of a tick bite.
There were some people that had spent their entire savings, their entire retirement, and they still weren't fixed. And that's a huge burden on a family.
Reporting for WDVM's In Focus, I'm Erin Miller.
At the federal level, West Virginia legislators helped pass the Lyme and Tick-Borne Disease Prevention, Education, and Research Act. This allocates funds to address tick-borne illness.
The disease is actually caused by a bacteria called Borrelia burgdorferi, and usually this bacteria is present in the mice and deer with or without affecting them. So these deer ticks, they act as vectors. They suck the blood from those animals, and then if they bite humans, then we get the disease. So the bacteria usually affects our nervous system or our musculoskeletal system. And that's how it causes the joint pains and nervous system disease.
So if it attacks the nerves, so the nerves are not working properly, like within the body, how does it look? What is it?
Usually what happens is after you get bit by a tick, the tick stays on your skin, attached to your skin for at least 36 hours, and then give the bacteria or release the bacteria under your skin, and from there the bacteria can disseminate or spread into your blood, and from the blood it preferentially attacks your joints or your nerves. See, if you find a tick on yourself and you feel like you are bit by a tick, first of all, you don't have to panic. Like I told you, not all tick bites lead to Lyme disease, and all you can do is you can submit the tick to the Department of Health for Lyme disease checkup, and just watch for symptoms of Lyme disease, which consist of a red round rash or fever and body pains. You watch for those symptoms for 2 to 3 weeks, and if you don't get those symptoms, then most likely you don't have Lyme disease.
Lyme disease is an infectious disease. It's caused by a bacterial infection by the bacteria named Borrelia burgdorferi in North America. There's other species of Borrelia that cause Lyme disease in Europe that are different, but in North America it's called Borrelia burgdorferi. The Johns Hopkins Lyme Disease Research Center was started about 3 years ago, and it was really formed in response to this epidemic of Lyme disease and this really focusing on all aspects of the disease, especially this group of patients that doesn't get better. And it was formed to to really focus on human-based research. And so you can't solve a human problem by only doing laboratory research with mice, which are the animal models for Lyme disease, or doing research in test tubes. Those are the starting place for research, but to really change people's health, that test tube laboratory research has to move into the human element. And that's why we formed this research center 3 years ago. It's based at Johns Hopkins. It's a clinical research center, so the research center really joins the patient's illness to the laboratory researchers. So now we're not doing research on mice anymore, we're doing research on the blood from patients with Lyme disease, and that's the only way to really bring innovation to the care of patients, is to have research that looks at human-based disease. And that's why we can translate that research into better diagnostic tests, better ways to predict recovery, and eventually even to potentially new therapies in the future. When you treat a patient with Lyme disease, the vast majority of the time they get better, but there is a subset of people that don't get better after initial treatment, and those are where we really need better tools, because repeating the antibody test doesn't tell you what's going on with that patient that's still ill. We need ways to measure and predict who's going to remain ill after their initial therapy. So that's one of the other themes in our research, is finding subgroups of patients the largest group of patients get well after the initial treatment, but we focus on the subgroup of patients that have remaining and ongoing symptoms after their initial treatment. And that's where we really desperately need to develop better tools, both to predict who's going to have those ongoing symptoms, but also to know what's going to help them, and whether by intervening in a different way that we can show that not only the patient feels better, but that their blood tests get better, so that we have a measurable way to know when the patient's responding to therapy. Our clinical care is seasonal, of course, because that's the other thing about Lyme disease. It's a seasonal disease. Acute Lyme disease occurs about a week or two after the tick bite, and the ticks are biting now. They bite, June, July, and then taper off into August. So acute Lyme disease follows several weeks after a tick bite. It's highly seasonal. In Maryland, 85% of our acute cases come in June, July. Chronic cases where people have lingering illness, those cases then are sporadic throughout the year because they're not as tightly linked to the tick bite. They can occur months or even years after the tick bite. Prevention is the key element that is important in education, because if you prevent Lyme disease, then you've saved the person the potential suffering of having this infectious disease. So there's some really key points about prevention that we emphasize a lot. One is avoiding the tick bites in the first place, and there's a lot of prevention advice that's applicable to avoiding tick bites, and so those include avoiding areas that have lots of ticks. So if you're a hiker, stay in the middle of the path, don't wander off into the high grass where the ticks are. If you're a gardener, stay in the manicured part of your garden, don't wander out into the high brush and perimeter of your properties, especially during this high tick season. So preventing exposure, and then also wearing the right kind of clothing. So we recommend people wear long pants, and that's really a key way to prevent tick bites, and especially effective if you treat your clothing with a chemical called permethrin. And you can find out more information about that at the CDC website about permethrin, and that's actually put on your clothing, not on your skin.
Welcome back. So we're joined now by Dr. Timothy Stonesifer in the studio. And like you saw in the story, what are some of the biggest challenges doctors are facing now in diagnosing Lyme disease?
So I think one of the biggest dilemmas in Lyme disease is the test that's available. The FDA approved test is a two-tier testing that's based on serology. And I think with some of the newer science over the last 10 years, the sensitivity on that test is not real good, meaning certainly I think there's a lot of patients that are being missed that may have Lyme disease, and actually they do have it.
So, and speaking of that, symptoms are so common to other major diseases. What should people do? If someone's feeling tired, or they're feeling fatigue or insomnia, should they immediately go get tested for Lyme disease?
I think that's a great question. Certainly in this area, I think you have to look at where the endemic areas are, and certainly in Pennsylvania, I'm sure down here in Maryland, we are at a very highly endemic area. So if someone comes in to me and says, hey, I work outside, I garden, I hunt, I fish, I'm always in the woods, and I remember several tick bites, then certainly they probably should be tested for that. Again, the problem becomes is most of them have been tested by their primary care doctors, and oftentimes the two-tier testing is negative.
And walk us through a test. What does it look like when a first-time patient comes in? What do they have to do for a Lyme disease diagnosis?
So again, the first test that would probably be done if you went to your primary care provider would be the FDA-approved test. That test may be negative, so if you continue to feel bad, that's usually the patients I see, and we have a sit-down and conversation and talk about the testing that is available that is not FDA approved.
And once a test comes back as positive, what are treatment options?
So early diagnosis and early treatment, I think, is relatively straightforward. Usually 3 to 4 weeks of an antibiotic, I think, usually cures the disease, although at this point I can't we really don't have a test to verify a cure or not. The patients I see are usually those that have had this disease for a period of time, sometimes years, and I think it becomes much more complicated. It's a very complicated disease. These people are very sick. They often have more than one infection. Their immune system is dysfunctional. Their inflammatory system is dysfunctional. And really, it's a very complex disease that may involve multiple antibiotics. It may involve natural products to try to boost the immune system, natural products or prescription products to calm the inflammatory system. So again, it's a very, very complex disease for those that have had this for a period of time.
And talk to us about the International Lyme Associated Disease Society. What is this organization? How are the methods and the viewpoints different from infectious disease scientists?
So you'll hear about the battle of Lyme disease, and that's what this is. There's really two sides that are kind of at grips with each other and saying who's right and who's wrong. So this organization was started 15, maybe 16 years ago, and really it was some advocacy groups and physicians that were treating and weren't seeing good outcomes. That was the protocol by the IDSA. So over the years, the ILADs really said, let's do patient education, let's try to bring this into focus and bring this to attention, and really through scientific evidence, let's try to find the answer and the truth to this disease.
And hopefully we'll find one soon. Thank you so much, Dr. Stonecipher, for your time.
Sure thing. Thank you for your time.
Lyme disease is a bacterial infection, okay, and it's transmitted by ticks. In our area, the tick that transmits it is known as the deer tick or the black-legged tick, and that they're really active. The nymphs of that tick are really active at this time of year, so this is a good time to really be on the lookout for ticks. We actually get cases year-round, and deer ticks can be active in the winter time. That's an important thing to know, because a lot of people, you know, it's cold weather. They're not concerned about ticks. They're not worried, but they can be active even during the winter time. But we do see a spike in Lyme disease cases right around this time of year, and that's because this is the time of year that the deer tick nymphs, the little ones, are most active, and they are probably the ones that are most likely to transmit Lyme to people, because it's very easy for that little tick to get on you and you wouldn't even notice it. It could feed and drop off and you would never even know that it had been there, because they're so small. One of the best things you can do is look for ticks, do tick checks, okay? If you have little kids like I do, when they've been outside in the woods running around, get them back inside, throw them in the bathtub, okay? That way you get an opportunity to look everywhere on their body and check anywhere for ticks, because ticks can hide and they can be hard to find, okay? That also gives you an opportunity to take those clothes off and get them in the wash, okay? And really it's the dryer that's most effective at killing ticks. If you run them through a cycle in the dryer, that would kill any ticks that were on the clothing. When you're out in the woods or in nature, stick to the trails. Ticks like to climb up on the vegetation, and it's really when you brush up against vegetation that they're getting on your body and that they're looking for a place to feed. So if you walk down the center of the trail, you're less likely to pick up ticks in doing that. There are some repellents that are effective at keeping ticks off you. If you used a DEET-based repellent, that will help prevent ticks. And if you're in areas where there's lots of ticks, there's even products that you can apply. Permethrin, for example, can be applied to clothing. You have to spray it on in advance, and it has to dry onto the clothing before you wear it, okay? But that's also something that can help keep ticks from getting on your clothes and getting on your body. If you wear long pants, pull your socks up over the pants, tuck your shirt in. That gives you more opportunity to find the ticks when they're crawling on your clothing before they're getting attached on your body. So that's another way, especially if you're wearing light colored clothing, that's going to help you to find those ticks quickly before they get attached. Sometimes I've definitely felt ticks crawling on me before, but they can be sneaky. I mean, they did not survive for millions of years by being obvious. You know, this is what they do. And so they can be really sneaky, and as hard as it may be to the public to believe this, they can easily get attached, especially if they're in your hair or some out-of-the-way place. And they could stay attached for several days, and you might not even notice them. So They have survived a long time by being sneaky and not by being noticed easily. This is what they do.
Can you speak on behalf of community outreach too?
Sure, we do a lot of outreach with the community because people just don't know, and we have to get this message out to the public and make sure that people understand that you are at risk for tick-borne disease in this area, and there are things that you can do that will limit that and reduce that quite a bit.